Hey, what's up? Hope you are doing well. Abdullah is here. Today we are going to discuss the topographical structures of head, neck, and thoracic region. Our second part is today. So let's start our discussion. In the last video, we cleared 26. Okay, so the next is the 27th structure, which is cerebral falx, or you can say in the Latin falx cerebri. Okay, so in which region we can find it? In the head region. Okay, so here you can have a look. This is the cerebral fault. So what is the function of it in the cranium? So let's see what is it. It's a large crescent shaped fold of dura mater that descends vertically, see, vertically into the longitudinal fissure. This is a fissure, longitudinal fissure, into the longitudinal fissure between the cerebral hemispheres of the human brain, because on both sides you have cerebral hemispheres, right? So it separates the cerebral hemispheres and supports dural sinuses that provide venous and CSF drainage to the brain. Okay, so this is falx cerebri. So what is our next structure? Our next structure is facial vein. Right, so facial vein, in which region we can find? In the facial region of the head. Okay, let's see what is it. So what is facial vein? Facial vein, here you can see, here this is your facial vein. Okay, so what is it? It's actually large vein of the human face. It commences at the side of the root of the nose. Okay, and it is the direct continuation of the angular vein. Here is angular vein. So the next structure what we have. So guys, have a look on this structure, like facial sheath of sternocleidomastoid muscle. So where we can find it? We can find it in the neck region. Okay, so let's see what is it. So here we have a transverse section of the neck region, right? So here, where is the sternocleidomastoid muscle? So here we have this one, sternocleidomastoid muscle. And which facial sheath discovered the sternocleidomastoid muscle? The second fascia of neck discovered the sternocleidomastoid muscle. And what is it called? It is called proper fascia of the neck. Okay. So the next structure what we have here right lung of root of the right lung, right? Okay, so root of the right lung, where we can find it? We can find it in the thoracic region. So let's have a look here. This is our lung and this is the right root of the lung. And let's see what are the peculiarities of the right root of the lung. So as you can see, it's on the mediastinal surface. It is the mediastinal surface of each lung where hilum is located. The constituent anatomic structures of the lung root are located here. What are the structures? Bronchus, okay, pulmonary arteries and veins, bronchial vessels and nerves, lymph nodes, other structures also available. And what is the syncope of the lung root components? So let's see about the right lung, because we have given only right lung here. Supero-inferiorly. Supero-inferiorly in the right lung, we have first principal bronchus, then pulmonary artery, then pulmonary veins. So, and the skeletotopy of the root of the lung is that it's located at the level of T5 to T7. Okay. So the next structure what we have here azygous vein, hemiazygous vein, and superficial temporal artery. So where we can find it? We can find it in the thoracic region. So guys, this is the thoracic region. Here you can see this is the azygous vein, and at this side it's the hemiazygous vein. Okay, so let's see what is it. and how can we recognize it from where it starts and where it ends. Okay, so azygous vein, as you can see, it's the branch which coming from superior vena cava. First it makes the arc, then it runs downwards as azygous vein, and at this side, as you can see, hemiazygous vein, it first is accessory hemiazygous vein, and before it it's left superior intercostal vein. Okay, so that's it. The next structure we have here, maxillary sinus. What is that? Maxillary sinus we can find in the facial region of the head. So let's see. So guys, as you can see here, this is a maxillary sinus. It's actually a pyramid shaped maxillary sinus. It's the largest of the paranasal sinuses, or you can see it is located in the maxilla. It drains into the middle nasal meatus of the nose through the semilunar hiatus. Okay, so the next structure we have here, the cellular space of the main neurovascular bundle of the neck. So it's the neck region. So let's open the neck region and let's see. So here we took again the transverse section of the neck region. Okay, so this is our fourth number fascia of the neck, which surrounds the neurovascular bundle of the neck. Okay, so this fascia is called endocervical fascia of the neck. Okay, and it surrounds like the surrounding of the neurovascular bundle. It's the cellular space, you can say. Okay, and the cellular space is surrounded by what? Fourth fascia of the neck, which is called endocervical fascia. So the next structure we have here, the left lung root. Okay, left lung root. So which region? Thoracic region, right? So guys, have a look here. This is a left lung root, this one, or as you can see here, this one, clear cut picture. So what is it? What is the skeletotopy? First of all, the skeletotopy is that the root of the lung is located at the level of T5 to T7. Okay, and next we have to see what? Syntopy. Syntopy of the lung root components. In the left lung, first you can find pulmonary artery. Okay, as you can see here, pulmonary artery, and the second principal bronchus, as you can see here down, and the third one is the principal veins, these two. Okay, so the next structure we have here, superior vena cava, aorta, and pulmonary trunk. So again, which region? Thoracic region. So guys, let's see here. This is our aorta, this is superior vena cava, and here is our pulmonary trunk. Okay, so the next structure what we have here, we have inferior orbital fissure. So this is the second picture, and here guys, here you can see the inferior orbital fissure, and this one is the superior orbital fissure. So let's see what is it. The inferior orbital fissure is a gap between the greater wing of sphenoid bone and the maxilla. So guys, here we have to show the vagus nerve on the back or in the thoracic artery. So guys, here you can see this one. This is the vagus nerve, okay, behind artery and vein. This is the vagus nerve, and in the thoracic region you can see here, this one is the vagus nerve, and here it's divided into left recurrent nerve. Okay, this one is left vagus nerve, left recurrent nerve, and recurrent nerve again goes to where? In the neck region to provide the larynx. Okay, so this is a vagus nerve. It's actually, it's the major part of the parasympathetic system. It controls specific body functions such as your digestion, heart rate, immune systems. Actually, these functions are involuntary. It means you can't consciously control them. Okay, so the next structure we have here, thoracic lymph duct. So in which area we can find it? In thoracic region. So guys, here is our thoracic lymph duct. As you can see, it's going. Okay, this is a thoracic lymph duct in the yellow color. Actually, it's also called as Van Horne's canal. It is the largest lymphatic vessel of the lymphatic system of the body, and in length it's approximately 40 centimeter in adults and approximately 5 millimeter width at its abdominal region. The thoracic duct extends from the 12th thoracic vertebra to the root of the neck. Okay, so that's our thoracic lymph duct. So the next structure we have here, endothoracic fascia. So as it's already indicated by the name, in which region we can find it? In the thoracic region. Okay, so let's see what is it. So as you can see here, this one is the endothoracic fascia. Okay, so what is it? It is actually a layer of loose connective tissue deep to the intercostal spaces and ribs. As you can see, it's deeper to the ribs and intercostal muscles. Okay, and this fascial layer is the outermost membrane of the thoracic cavity. Actually, thoracic cavity, it starts under the endothoracic fascia, from the endothoracic fascia, and the endothoracic fascia contains variable amounts of fat. As you can see, pleura also lies down to the endothoracic fascia. Okay, so what's the next structure? Next we have middle meningeal artery. It's located in the facial region of the head. So let's see. So guys, as you can see here, the middle meningeal artery, this one. Okay, so what is it actually? It is actually the largest of meningeal arteries. It typically arises in the infratemporal fossa. Okay, and it is a third branch from the first part of the maxillary artery. Okay, as you can see, this one is a middle meningeal artery. So let's see the next structure. What we have here, retropharyngeal cellular space. Okay, so in which region we can find it? It's as showing here, pharyngeal, so in the neck region. So let's see what is it. So guys, here you can see, first of all you have to find the pharynx because it's retropharyngeal. Retro means behind and pharyngeal means pharynx. Behind the pharynx is the space. So where is the pharynx? Here you can see this is the pharynx, and here is, this one is a larynx. Pharynx like gives rise to what? Esophagus, right? And the space behind the pharynx and esophagus, it's called retropharyngeal space. As you can see here, this space is a retropharyngeal space. Okay, and it extends between the base of the skull superiorly and the mediastinum inferiorly. So it is the length, you can say, and it contains also retropharyngeal lymph nodes, and the function is to facilitate movements in the supero-inferior axis of the larynx, pharynx and esophagus in relation to the cervical spine. Okay, so that is our retropharyngeal space. So the next structure we have here, mylohyoid muscle. So which region? Again, we can find it in the neck region. So guys, here you can have a look. This one is our muscle, mylohyoid. As you can see here, this one this one, like it makes what it makes the floor of the diaphragm. Okay, and it's the paired muscle of the neck. It runs from the mandible to the hyoid bone. Here is our mandible, and this one is the hyoid bone, and it covers the distance, this distance, to form the floor of the oral cavity of the mouth. So the next structure we have, again, vena azygos and hemiazygos. We already discussed it, so let's see one more time. So here you can have a look. This one is your azygos vein, okay, and this one is a hemiazygos vein. So what's the origin of the azygos vein? It's, you can see here, superior vena cava. First it forms arc, then it goes to azygos vein. Azygos vein gives rise to what? Intercostal veins, okay. And hemiazygos vein, first we have your left superior intercostal vein, okay. So the next we got accessory hemiazygos, then we got the hemiazygos vein, right? So what's the next structure we have here? Cavernous sinus of the dura mater. So in which region we will find? We can find it in the head region, cranial region of the head. Okay, so let's see what is it. So as you can see here, this one is our cavernous sinus on the lateral side. Okay, so what is it? It's actually in the human head. It's one of the dural venous sinuses, creating a cavity called the lateral cellular compartment, which is bordered by temporal bone of skull and the sphenoid bone, and it's located lateral to the sella turcica. This one is sella turcica and is located laterally. Okay, so the next structure what we have here, retromandibular fossa. So this is, again, you know what does it mean? Retro means behind and mandibular means mandible bone, and we have to find what? We have to find fossa. So in which region we can find it? In the facial region of the head. So guys, as you can see here, the retromandibular fossa, this is our mandible bone, okay, and you can find it just near the external auditory meatus. Okay, so this is our retromandibular fossa. So what next we have? So guys, the next structure we have here, it is called Pirogov's triangle. It's another name, Pirogov or Pirogovs, both are correct. So let's see where it is located. It's located actually in the neck region. As you can see here, this is the Pirogov's triangle. So what is it? It is an area in the human neck formed by the intermediate tendon of digastric muscle, okay, digastric muscle, and the posterior border of the mylohyoid muscle and the hypoglossal nerve, okay. And this triangle, it's actually, you can find the lingual artery also in the Pirogov's triangle, which lies underneath the fibers of the hypoglossal muscles. So this is our Pirogov's triangle. So in another picture you can see the clear cut look. As you can see here, this one is a Pirogov's triangle, okay. So this is our digastric muscle, this one is the posterior side of the mylohyoideus muscle, and this one is our hypoglossal nerve, okay. So this is triangle of Pirogov. So the next structure we have here, internal thoracic artery. So what will be the region will be the thorax. So let's see, here we have this one in the red color. As you can see here, it is called internal thoracic artery. So what is it actually? From where it arises? It arises from the anterior surface of the subclavian artery. It has a width of 1 to 2 millimeter. It travels downward to the inside of the rib cage, approximately 1 centimeter above from the sides of the sternum. okay, and it is medially to the nipple, as you can see here. It lies medially. So the next structure what we have here, we have spinous foramen. So guys, have a look what is it, and from where we can find it. It's actually lies in the cranium. So guys, as you can see here, foramen spinosum here, okay, or you can recognize as like it's like near the foramen ovale or foramen lacerum, okay, it's near them. So what is it, foramen spinosum? It is actually a small open hole in the greater wing of the sphenoid bone. This is the sphenoid bone, right? That gives passage to the middle meningeal artery. As we already discussed this artery previously, middle meningeal artery and vein, and the meningeal branch of the mandibular nerve. Okay, so this is our foramen spinosum. So the next structure we have here, oral vestibule. So guys, as you can see here, we have to find what? We have to find the oral vestibule. You can find the oral vestibule between the lips and the teeth. The space between them, it is called oral vestibule, and the space inside is called cavity proper. The oral vestibule refers to the narrow space between the lips and cheeks and the external surface of the teeth, okay, and the inner labial surface is attached, as you can see this one is attached in the midline in the gingua. This one is the gingua via the frenula of the upper and lower lips. This one is the frenula, gingua lips, and they are attached by with the help of frenulum, okay, both upper and lower. So the next structure what we have omoclavicular triangle. So guys, guess what's the region? The region will be the neck region. So let's see, we have omoclavicular triangle. So first of all, you have to recognize the muscles also in order to find this triangle, okay. So this one first we have what? Omohyoid muscle, okay, and the muscle that is cut from here, this one, what is it called? It is called sternocleidomastoid muscle. So omohyoid and sternocleidomastoid, take omo from here and clavicle, because sternocleidomastoid attached to what? Clavicle, okay. And what is it called? Omoclavicular triangle. Understood? Omoclavicular triangle. And it is also called as supraclavicular triangle because it's just upper to the clavicle, okay. So that's a omoclavicular triangle. So the next structure what we have here, superior vena cava, aorta, and the pulmonary trunk. So which region? In the thoracic region. So guys, as you can see here, this is the superior vena cava, this is our aorta, and this is what? This is our pulmonary trunk, okay. So the next structure what we have here, sigmoid sinus. So we can find it in the head region. So let's see what is it. So here you can see the sigmoid sinus, okay. It is actually S-shaped hollow curve. It is also known as the paired dural venous sinuses within the skull that receives blood from posterior transverse sinus. This one, posterior transverse sinus, and it receives the blood from it. And what's the next structure we have? We have right and left ventricle of the heart. Okay, so let's see what is it. So guys, as you can see here, this one is the right ventricle and this one is the left ventricle. So what are the functions of the right ventricle and the left ventricle? Actually, the right ventricle receives deoxygenated blood from the right atrium, and it sends to the pulmonary trunk, to the lungs, to be oxygenated. When blood is oxygenated, it comes to the pulmonary veins on both sides, and it went to the left ventricle, and from the left ventricle it goes to the aorta and then whole body. So these are our ventricles. So the next structure what we have here, the cervical plexus in the omotrapezoid triangle. So first of all you have to find the omotrapezoid triangle. So what does it mean, omotrapezoid? Okay, so as you can see here, this one is the omotrapezoid triangle. This one is the omohyoid muscle, sternocleidomastoid muscle, and this one at the side, this is trapezoid muscle. So omotrapezoid triangle, right? So you have to find what? You have to find the cervical plexus. As we already discussed our omotrapezoid triangle, so let's see what's the cervical plexus in it. So guys, here you can see this one is a omohyoid muscle, trapezoid muscle, and sternocleidomastoid, and this one is our cervical plexus in the omotrapezoid triangle. And the major branch of this plexus is the phrenic nerve, which arises from the anterior deviance of spinal nerves from C3 to C5. Okay, so guys, that's all for today. Thank you for your attention. Goodbye.